Hello, this is Katie Baca with BSN366, and I am performing the central line dressing change video. I have on my school attire, badges visible, and I have clean nails, no polish, and I have pulled my hair back off of my neck. So I have reviewed my provider's orders and gathered my supplies and entered my patient's room. I have provided patient privacy and performed hand hygiene. I am now going to introduce myself to the patient and explain the procedure and verify their name and date of birth. Hello, my name is Katie. I'm here to perform your central line dressing change. Can you please tell me your name and date of birth? Okay, thank you. So what I'll be doing is I'll be changing the bandage there on your central line. It is a sterile procedure, so you will need to either turn your head away or wear a mask, and they want to wear a mask. So we'll go ahead and apply those now. I'm going to apply my mask first, and then I'll apply my patient's mask so that I'm not contaminating myself with their germs. Okay, and then now I'm going to perform hand hygiene and apply my clean gloves. So first to start, I'm going to remove the old dressing, lifting all four corners, working my way towards the insertion site. And I'm going to want to hold down the line with my non-dominant hand to prevent the tube from becoming dislodged. And so I'm going to start here with the corners. And you want to pull parallel to the skin and towards the insertion site. And lift and discard. Okay, and so now what I'm noting is I'm looking at the catheter, the insertion site, and the surrounding skin. The catheter, I'm looking for any kinks, leaks, or any signs of dislodgement. The insertion site as well as the surrounding skin, I'm looking for any redness, drainage, signs of irritation, or any swelling. So I don't see anything. It looks good. So we're going to go ahead and move on from there. So I'm going to remove my clean gloves, perform hand hygiene, and open my central line kit. So away, and I'm going to pinch the corners to keep it from falling back on me, just using that little 1-inch border there. And I'm going to pinch my gloves and open my gloves. And again, the 1-inch border, maintaining my sterility. And so what I'm going to want to do is pinch and kind of fold it out so it doesn't fold in on me. And I'm going to apply the glove to my non-dominant hand first, grabbing the cuff with my dominant hand and pulling that one on. And now my dominant hand, thumb away. And on. And now that I'm sterile, I can fix that pinky and pull it on better and secure my gloves. So now I'm sterile. I'm going to keep my hands above my waist and not touch anything that is not sterile. So for starters, I'm going to grab my chlorhexidine, crack it, and allow it to become completely saturated. And while that's doing that, I'm going to go ahead and grab my forceps. These will be used to lift the catheter so that I can clean all the way around the insertion site. So we just want to hold it gently. We don't want to actually tug on it at all because that could dislodge it. So now this is chlorhexidine, so I'm going to be going in a side-to-side motion for 30 seconds. So, and the size of, it has to be completely the size of the dressing I'm going to be putting on. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. Now I'm going to clean the underside of the tubing and the top side of the tubing. Okay, and now I can dispose of these. And I'm going to allow that to completely dry. So in the real world, obviously it would not be dry yet, but we're going to go ahead and say it's dry now. And I'm going to grab my Tegaderm, peel the backside off, place it completely over the insertion site, and try to get as little amount of wrinkles or air bubbles as possible. And then I'm going to peel the outer edge, and again, securing it down as I go. Okay. And then I'm going to use this little extra piece here to label my date, time, and initials. And then I want to peel that off and place it somewhere that is not over the insertion site so that can continue to be monitored. So we're going to put it right at the edge of the dressing. And that's what the, got the mask. That's what the dressing should look like. So that's all done. So now I can dispose of my equipment. And remove my sterile gloves. Perform hand hygiene. Now I'm going to remove my mask first and dispose. And then I would remove my patient's mask, which fell on the ground, and dispose of that one. I'm going to perform hand hygiene once again. I want to position my patient for comfort and safety and go document my procedure. Thank you.